Good morning. Welcome back to Morning at NTV. My name is Malaki Vilodera. Today the conversation is on decent toilet sanitation, hygiene, water. Yes. So the hashtag is Morning at NTV. You can stream us live and drop in your comments. NTV Uganda, that's on Facebook and YouTube pages. But what can we do to improve this? What are the solutions? In Uganda, 2,870 children under the age of 5 years die each year because of poor sanitation. We do have a role to play. So in studios to talk about that is Madam Martha Naigaga. She is a sanitation coordinator at the Ministry of Water and Environment. Welcome to the show.
Thank you. Good morning.
Good morning. Next to her, we do have Mr. Cesar Chimbugwe. He is the Sustainability Wash Manager at Water Aid Uganda. Welcome to the show, sir.
Thank you very much. Good morning, viewers.
Good morning. Now, the conversation about sanitation, Andrew Chamagero was on ground and there are many issues to do with it. But someone would ask, of course, with you, Madam Martha, representing government, what so far is being done to ensure that this is addressed? When you talk about sanitation, people think that it's not a priority, but it sure is.
Yes, I want to thank you for inviting us to this talk show to highlight the importance of sanitation in this country. As government, a lot of efforts have gone into sensitization and teaching and provision. Government actually does provide sanitation, especially the public sanitation. The role of providing sanitation in the household lies with the household. Yeah, for individuals, we teach them, we trigger, we actually call it demand creation. We teach them about the importance of sanitation and expect them to invest in sanitation at the household level because it's an individual thing. And government does the bigger things of construction of sewers, fecal sludge treatment plants, arranging the sanitation market in terms of who does the emptying, how are they organized, all that. The bigger things are done by government.
Are done by government.
Things about investing in a household level, it is the duty of the household.
Okay. Before I go to Mr. Caesar, of course, government does also build toilets in public facilities.
Precisely.
And many people say that these are the toilets that you can't even think of going into. So in terms of management and, you know, just cleaning and maintaining these particular toilets, why do we have dirty ones?
Usually it is an issue of management and a willingness to have a system that works by both the users and us, government, who actually invest in it. When we put across a committee to manage this toilet, and we want people to pay a bit of money to be able to access, that's what takes care of the management and the maintenance, but people are always not willing to pay. So it cannot happen by magic. That's why we must continue to do the sensitization and create awareness and make people start to think that having access to a clean toilet is actually something very good. Right. And it has a cost to it. Nobody is going to sit there and clean and provide the toilet paper, provide the water and make sure it's always running and at no cost. So while we want to demand as the public that we want clean toilets, we should be willing to be part of it and actually invest in it. Right. So when you want to go to a toilet in Kampala or somewhere in a public place, be willing to part with some money so that the person that you find at the entrance of that facility is able to keep. And that's the only way you're able to actually demand for the quality and say, well, I paid my money, why is this toilet dirty?
But the president had a different view when he visited traders in downtown just a few weeks ago, and he said, of course in downtown for you to access a toilet you have to pay. So traders there were complaining that we have to pay to access a toilet, and so the president said and actually issued a directive to KCCA that no person should be charged to access these toilets. But I get where you're coming from. In the event that we want our toilets to be safe and clean, and safe we mean in terms of us getting infections, and clean, then we really have to pay something. Mr. Caesar, you're always on ground. How bad is this situation in terms of the toilet coverage in the country, both in schools and in the household levels? Where are we at as Ugandan?
Yeah, thank you very much, Mala. In terms of coverage, you're talking of the national standards. The national standards provide for access to decent toilets in schools. The standard is 1 stance per serving 40 pupils. That is the standard. But as we stand, 1 stance is serving over 72 pupils in schools. And that's quite a huge number that we are looking at in schools. But the situation in schools is over and over again, it's improving. But at the community level, that's where you find the biggest problem. So you're talking of 82% accessing toilets in urban areas, and you're talking about 79 in rural areas. But again, those numbers, my friend here, Martha, will agree with me, that they are calculated based on the national indicators that we use to see who is accessing a toilet. But as a country, we've committed to the Sustainable Development Goals, and this calls that we look at service levels, improvement in the quality of service. So you find that if we factored in the Sustainable Development Goal indicators, that access level can go significantly low. Because you're talking of safely managed sanitation services, you're talking of a decent toilet, a toilet that provides privacy. Have you gone to a toilet where you cannot lock yourself from inside?
Right.
That's not access to a toilet as per the SDG standards. So we are talking of improvement in the quality of these toilets, and we are talking of safety, especially for the women and girls. You know, as Water Aid, where we're coming from, our interest and our niche is looking at the safety of women and girls. We are talking about equality, we are talking about equity, and we feel women suffer more when it comes to accessing a decent toilet. Talk of dignity. We've talked of the toilets in the city. Do you know that women don't drink or even eat because they know they will not be able to access a decent toilet?
Right.
So you're talking of health, you're talking of issues of dignity, and that touches us so much as Water Aid.
Okay. And Martha, I know you're always on ground, of course, as government. When it comes to the issue of dignity, like he says, privacy, especially for the women and children, I'm sure when we were having this conversation, you're telling me it's really bad because even women end up being abused, you know, because of lack of access to private and safe toilets. So how bad is the situation on ground?
The situation, whereas a lot of effort is going into improving it, the situation is not yet where we want it. Like Cesar has already alluded to it, we want access, universal access, meaning everybody must have access by 2030. Right now, like you said, 79% in rural areas, but that's for any form of toilet. If you went down to segregate and actually count, for example, the improved in rural areas, it brings us down to 16%. Yeah, a toilet which offers the health benefit of having a sanitation facility. You know, going in there and you're sure you'll not get out with an infection. You're going to be safe. You're going to be enjoying the privacy that you need and the dignity that comes with it. So we are still doing very badly. In schools, the average is 73:1, but I'll tell you that in some schools it's even as high as 120. In some schools in rural areas there, with the coming of UPE, we've not been able to match up the increase in enrollment with provision of such facilities. So you find that some schools have as low as just 2 stances, one for boys, one for girls. In some instances, they even have to share, which is really, really unfortunate because for the girls, especially when they're going through their menstruation, they will just not come to school. They'll keep away. And if they're going to keep away for a week every month, that's a lot of time that is lost. Yeah.
Madam, Mr. Cesar, just let us in on this. When we talk about sanitation, decent toilets, we can't run away from the factor of water, access to water, of course, hygiene. So with regards to planning and just coming up with this kind of infrastructure, what planning needs to go into this?
Thank you very much. Sanitation, talking about toilets and sanitation, you cannot disassociate that from water and hygiene. It's a full package. And for us where we come from, we call it wash. Wash is not washing just hands or whatever, it's water, sanitation and hygiene. So the delivery of this comprehensive package is very critical in addressing these issues holistically. So the challenge is there are different roles and responsibilities in providing these services. The provider for water, if we talk of Kampala or urban areas, That's the mandate of National Water and Sewage Corporation. That's a government parastatal. Then if you come to sanitation, for instance, in Kampala, that's the mandate of Kampala Capital City Authority. But that is on-site sanitation. Again, if you talk of sewage sanitation, again, that's the mandate of National Water and Sewage Corporation. And you're talking of a problem that is very huge in terms of institutional arrangements, in terms of roles and responsibilities, in terms of setting policies that should provide these services and sustain them. So there's need for the institutions to work together. The institutions I'm talking about, Ministry of Water and Environment, where National Water and Sanitation, where National Water and Sewage Corporation falls. You're talking of KCCA, which is more of an autonomous institution as well. It's not a local government, but it's providing these services for sanitation. How do they come together to provide the services? You're talking of financing. Are there sustainable financing mechanisms available to provide these services? Because at the end of the day, you're talking of on-site sanitation, talking of sewage sanitation. We now stand at less than 10% for sewage sanitation. That is sanitation connected to the national sewer grid. That is too low. So over 90% is on-site sanitation. On-site meaning that sanitation for most of us, where you have a septic tank, where you have a toilet or a latrine, where you need to empty that latrine, there is need for money and investment by government to ensure that even those that are using on-site sanitation, from the level of containment, there will be systems to transport, to collect this fecal sludge, transport it, and then treat it, and then reuse it. So that is a whole chain that requires sustainable investment in the sector. And we call upon government, Minister of Finance, to increase resources to this. It means a huge level of investment because we've committed as a country to the Sustainable Development Goals. It means the story can't be the same.
Right.
We need more investment to ensure that there's a whole system that provides water, that provides decent toilets, but also look at the whole behavior change aspect around hygiene.
Okay. Madam Martha, of course, we know already with the statistics that you've given us is that we don't have enough facilities to manage the number of people that are there. So when it comes to the process of even approving, you know, the construction of such a structure, maybe a toilet, a pit latrine, what's the process like? Before I even start or think of digging a pit latrine, what standards should I abide by, and what are the procedures of getting that particular approval?
In urban areas, we call them planning areas, there are guidelines. The authorities there are supposed to receive a plan. Usually you don't submit a plan for the toilet only. It's part of the house. And the house is incomplete if it has no toilet. So when you submit your plan, your building plan, to the authority, whether it's KCCA or any other municipality or a town authority anywhere, they're supposed to scrutinize it and see what have you proposed. What's the size of your house? How many people do you think are going to be staying there? Have you provided spaces there, no overcrowding? And then the toilet facility. What plan do you have for it? The size of the septic tank? All that is supposed to be looked into. There are technical people that are able to assess and say, yes, this works, this does not work. In the rural areas, it's a little different. Because such things don't happen. Everybody does their heart somehow and they construct their toilet. But still, there are support structures that enable that process to go on in the villages also. We have staff that are called health inspectors. They are supposed to work with communities and guide them that after creating the demand and making the community aware that they actually need a toilet, they need to assist them to site it, to locate it properly, but also to identify the technology that works for them. Yeah, for example, if I live in an area that has a high water table, that is waterlogged, or an area where I cannot dig the 10 feet, the 20 feet, yeah, I should be able to access sanitation that is suitable for my condition, yeah. And the health inspectors that are in touch with the communities should be able to provide that guidance, that it should be 10 meters away from the kitchen, 100 meters away from the water source, yeah? And it should not be upstream of a water source. By upstream, I mean that it should not be on the higher side and then the water source is down.
Right.
You know, there are guidelines that exist. We have laws, we have these things written down. And that's why I said as government, our role is to continue to educate, but also enforce, yeah, whereby we go to these people and tell them that, you see, you did this, but it is not working for these reasons, and we need you to correct it.
Yeah.
Excuse me. So that should happen everywhere.
But in terms of enforcement, I think it's also a challenge right there.
Very big challenge, I must say.
Because how do you tell someone, how do you come order someone around in their own piece of land? They'll be like, but this is my land. How do you tell me where to construct a latrine?
It is your land, but according to the Public Health Act, but also the Constitution of Uganda, everyone, every Ugandan or everybody living in Uganda has a right to a clean and healthy environment. Now, that means that if I have a right as a person and whatever happens on my land is my right, that's okay. But that should not interfere with someone else's enjoyment of their rights.
Right.
So if I am going to do something on my plot that is going to interfere with somebody's enjoyment of their own right, I have a responsibility, I have an obligation, yeah, to actually make my neighbor safe. And my neighbor should be in position to do the same. Right. And to demand that actually if I have, for example, a toilet which is badly managed in my house and it is producing effluent that is flowing into the environment, it will not discriminate that it came from this source, so it will not go, it will affect only this one. No. So it's a public good. Health is a public good that we must really promote. And what you do in your own household has an effect on what your neighbor feels.
Right, right. Mr. Caesar, let's get down to the cost as well, because many people, especially in the rural areas, will be like, I've been having this latrine for X number of years, but I don't have the money to actually construct a new one. When it comes to pit latrines, how many years should they serve someone or a family or a household or a school? And when it comes to constructing actually a new one, roughly what's the range?
Thank you very much. The issue of costing sanitation, it really depends on the technologies used. First of all, the cost of a toilet in a rural area is different from one in an urban setting. I can give you an example for the schools where we've done a lot of these constructions in the urban areas. The cost for a waterborne toilet, about 16 stances, waterborne with a septic tank. And for us, because we value the issue of inclusiveness, equity and inclusion, we make sure that the designs cater for the special needs of women and girls. So we make sure that the menstrual hygiene management component is part of the design, that girls will be able to have a washroom where they can change their menstrual pads. They will be able to, we also provide for the disabled people a stance for them, for both boys and girls. We are looking at the privacy in that design. You don't want a stance, a toilet block where boys and girls are using the same block, right. Maybe boys behind girls. There's no privacy there. So you want to come up with a design that will provide privacy, that will cater for the special needs of the girls and the women for that matter. So that design caters for not less than 60 million
Uganda shillings. Okay.
And it's quite costly. But then you're looking at other designs like biogas toilets, which are being promoted in Kampala, for instance, in the schools. And those come in, again, to address another problem which you talked about, access to water, affordable water. When the policy in Kampala changed, for instance, to avoid the pit latrines, and now the policy direction is waterborne toilets. Now the schools are suffering for paying the water bills.
Right.
So you're solving one problem and then creating another. So how do you harmonize the two? So you have these other new technologies, biogas toilet, which uses far less water, and schools are able to use them and access a good toilet, but at the end of the day be able to meet the water bills.
And a basic pit latrine?
A basic pit latrine in a rural village could go less than 5 million.
Okay,
Yeah.
less than 5 million.
Yeah.
Let me ask you, in terms of inspection, Madam Martha, I was in school, and I remember you're also in school at some point, maybe high school, secondary school, and I'm sure even in your school, after you come out of the pit latrine, there were no taps to wash your water, to wash your hands, and that's a basic.
Yes.
A basic when it comes to hygiene and sanitation. So is the government also getting into that, just inspecting schools and households just to ensure that the water bit is catered for, that even if you can't afford a waterborne, you know, kind of toilet, if it's a pit latrine, then there's provision for students, people to wash their hands after visiting their toilet?
Yes, thank you so much. I'll talk about the issue of hand washing in just a bit. We're promoting hand washing after toilet use.
Yes.
And in our design or our proposal for the toilet facility, we actually don't want to count a toilet as a complete toilet if it has no hand washing facility. Now, in that, for schools where we are promoting institutional sanitation, we usually provide a rainwater harvesting system that's able to harvest the water from the roof and provide water for hand washing. Yeah. At the toilet. But we also want hand washing to happen at different times, not only after the toilet. In a school, people share a meal at lunchtime. People should be able to wash hands at several times. Yeah, before they eat their food, after they eat their food, after they come out of the toilet. So we are promoting hand washing to happen several times. But that means that government's effort to increase access to safe water should be actually doubled. We are doing a bit well, but not yet there. As government, we are moving away from providing just point water sources. By point water sources, I mean a source that is just stationed somewhere, and everybody who wants water must come to the source. For example, a borehole. Excuse me. Everybody who wants water in a village used to go to a borehole. Now, as government, we moved a bit away from that. We've started to increase access to piped water, even in villages. Or actually motorizing the boreholes that we have to make them so that we can build a system around them and increase the fetching points, so that people come and they don't have to queue for a long time. And also in line with the Sustainable Development Goals, we are actually supposed to provide water on the premises.
I can imagine that. So, but what you're saying is that you can't have such enforcements and such laws in place until even the government, you know, provides accessibility to clean water for all. So it's something that is on the balancing. You can't do this and yet you haven't provided the water in the first place, right? Okay, Mr. Caesar, I asked you a question. How long should a latrine serve me? Let's just stick to the latrine.
Yeah. The designs that we've been promoting, for instance, in schools, go up to 25 years. But then the most important thing is the operation and maintenance of these toilet facilities. If you're constructing in a high water table area, the toilet should be emptyable. It should be lined, for instance. The walls must be constructed so that they can empty that latrine. And that's the improvement in the design that we are calling for, especially in the slum areas where you don't have space, that you can demolish this and construct somewhere else. You need a lined toilet that can take you for over 20 or 30 years. But the operation and maintenance is very critical. And we are talking about the capital investment in these facilities, which most of us are focusing on. But over time, there are so many costs that come in: emptying, replacement of broken material. So all that needs to be factored in. But I wanted to mention a little bit about the hand washing, which we've been talking about. It's a behavior, and it starts from home. So most of the times, government, NGOs provide these facilities for the schools, a hand washing facility that has water and soap. you're not washing hands without soap.
Yes.
You're just wetting your hands.
Yeah.
So
You're
just
wetting your hands.
You're just wetting. There has to be soap.
Right.
And schools have a problem with that. Children take the soap back. And that's what head teachers are telling us. Yes, we provide the soap, but at the end of the day, you won't find the soap. So there has to be this sensitization. The parents need to talk to their children so that they know that these are things that are needed every time to wash and clean their hands. And that's part of the operation and maintenance. But the budgets that we give to operation and maintenance are so low. Most of the times we invest in this infrastructure and leave it. Whoever knows how it will function, we do not care.
Right.
Yeah.
Madam Martha, of course, as we come to a close, like he's saying, mindset change, behavioral change, very key to note. But when it comes to even using the toilets, basic toilet etiquette, is there a need for us to include a topic or subject in schools where our students and children actually taught about this? Because we know we have even adults who don't have toilet etiquette. So is it important for us to change, and so that the next generation actually knows how to conduct themselves around toilets?
Okay. Actually, the Ministry of Education has done well in this regard. They have work around basic science and basic health, and they actually do teach this in schools. But like I said, it goes back to where people come from. As we do this at school and we have services, we have a facility that we are accessing. Do we have it at home? Some homes don't have a toilet. So a child will go and practice all their etiquette at school, but at home they're derailed. They cannot continue. Yeah. So I will say that it is important for us and Ministry of Education to continue providing the sensitization as part of the curriculum. But as adults, because we know that there are so many people who have skipped that and not not being able to think about it positively, we must continue the education. That's why we are here today. Even in a workplace like this, we must continue to do the sensitization, because, oh my God, it happens everywhere. You walk into an office, in a toilet, and you're like, oh, you don't like what you see.
Okay.
So it must continue, because we come, I mean, these, like, for example, workplaces, public places, they collect people from all walks of life. Yeah, but I'll also say something about maintenance. As providers, if you are an employer and you're going to put up these office facilities, first of all, you need to take care and provide the right kind of facilities in adequate numbers, and also have a plan to maintain them well, so that the person who comes to use the toilet actually finds it sparkling clean, and that will give them the impetus to actually keep it clean.
Right.
You know that when you go to a toilet which is clean, you'll most likely not want to be the one to make it dirty.
It's true.
And when you go to one which has been mismanaged, you'll also be just as careless. So it's all of us. We have a role to play in this, as family members, as homemakers, institutions, mothers, name it.
Okay.
Yes.
Thank you so much for coming in studios. Madam Martha Naigaga, Sanitation Coordinator at the Ministry of Water and Environment. Thank you so much. Mr. Caesar Chimbugwe, Sustainability Wash Manager at Water Aid Uganda. Thank you so much for making time. So we now agree. This training shouldn't just be in schools for our children. As institutions, in case you're a manager, we need to retrain even the adults on how to handle themselves around toilets. Very important conversation. So keep your views coming. The hashtag is Morning at 10 TV across all social media platforms. Morning at 10 TV still continues. Keep it here.